Hi, I am Vana, I am a hypnotherapist, and I have an interest in tools and techniques that promote well-being. Today, I will discuss the scientific journal titled Self-Hypnosis Training for Headaches in Children and Adolescents by Kohen and Zajac. I am particularly interested in the therapeutic suggestions that helped the patients in the study with their headaches. This was a retrospective study of data from 144 children and teenagers who suffered from recurrent and chronic headaches. These patients tried self-hypnosis because medication or other treatments were not providing adequate relief, or they just wanted to stop the medication. The findings indicate that training in self-hypnosis is associated with significant improvements of chronic headaches in children and adolescents. Self-hypnosis helped with the intensity, frequency, and duration of headaches. In particular, after learning self-hypnosis, 26% of patients became completely free from headaches, and the vast majority, 97.6%, reported some positive outcomes in the intensity, frequency, or duration of headaches. The self-hypnosis training program was normally completed within 3 or 4 sessions. However, some patients needed up to 20 sessions to become competent in using self-hypnosis on their own. Patients were advised to apply the self-hypnosis techniques in a period of 15 to 20 minutes in a quiet space. Self-hypnosis training included hypnotic induction, deepening, and therapeutic hypnotic suggestions. I will only discuss the suggestions as they are the most important for managing or eliminating headaches. So, I will now give you the menu of 4 therapeutic hypnotic suggestions offered to patients in the study. I will also give my own titles to the suggestions to make them easier to remember. First, the safe place suggestion. When you have a headache, then you imagine a place where you've never had a headache and engage your multisensory mental imagery. For example, if your safe place is the beach, then use your visual, auditory, and tactile senses by imagining the warm sand and how it feels on your feet, and imagining the sound of the waves and the birds in the sky. Second, the ruler suggestion. To practice this, you imagine a ruler with numbers from 0 to 12 on it. You use this ruler to measure your headache. Notice the number that represents your headache. Perhaps it is a 9, a 6, or a 5. Then watch the number go lower. Third, the elevator suggestion. This is similar to the ruler. You imagine you are on an elevator and the floor number represents your headache. Then you push the button to write down to 6, 5, 3, and then all the way down to 0. Finally, fourth, the comfortable object suggestion. Imagine that the headache has a shape and a color, and in another part of your mind, imagine the color and shape of a happy and comfortable feeling. Then watch the shape and color of the headache get smaller and smaller and smaller, whilst the shape that represents that happy and comfortable feeling gets bigger and bigger until it fills out the entire screen in your imagination. However, you are not restricted to using the suggestions I mentioned. You may use your imagination in your own way to manage the headaches. In my experience as a hypnotherapist, I find that measuring the level of the headache before and after self-hypnosis is important. Also, when discomfort is represented with a number, for example in the ruler and elevator suggestions, I personally find that sometimes it is easier for my clients to make the discomfort slightly worse by raising the discomfort number before reducing it, giving them a sense of control. I find that all the therapeutic hypnotic suggestions in the study are great because the experience of headaches is abstract. But by representing the headache as a ruler, an elevator, or an object means you have something concrete to work on and change. And even though I personally use different approaches to help people with discomfort, the selection of suggestions presented in this study on self-hypnosis training for headaches are incredibly valuable, and not only for chronic headaches, but for other types of discomfort too. But please keep this in mind. You should consult with your doctor first if you have headaches or some kind of discomfort, and think of using self-hypnosis. Following the doctor's advice is very important, as you do not want to mask any serious health issues. Please like and subscribe, and put any thoughts or questions in the comment section below. Thank you for watching, and bye for now.